collaboration with the Cyprus Mail, this is the Cyprus News Digest with Rosie Charalambous.
This week we meet a doctor from the United States who's part of an organisation that's been visiting Cyprus for nigh on 40 years. Cypriot children are given orthopaedic treatment at the Shriners hospitals in the US.
Once they get to our hospital in Springfield, Massachusetts, that care is paid for by Shriners. And we have at least one Cypriot child in our facility today, and she had spinal fusion last week. She's doing quite well. Early in the summer, there was a period where we had 7 families at once.
And staying on a health theme, a promising new drug is offering hope for thalassemics.
Their transfusion needs with this drug that is given subcutaneously with injection once a week can reduce by 33 to 50%.
Doctors from the Shriners hospitals in the United States were in Cyprus last week, assessing children here who have orthopaedic needs. I spoke to Lee Kirk, who's the administration officer of Shriners Hospital for Children in Springfield, Massachusetts.
The Shriners Hospitals for Children in Springfield, Massachusetts we are part of a specialty children's hospital system that has 22 locations, 22 facilities in North America, all in the United States except for the one in Mexico City and Montreal. Our first hospital opened in 1922. The hospital in Massachusetts in Springfield opened in 1925, so we're in our 95th year. We specialize in pediatric orthopedics, neuromuscular disease, and these are children that may have congenital issues such as club feet, they may have scoliosis, they may have cerebral palsy, spina bifida. So that's in essence, it's all related to orthopedics typically.
I guess that back when it all started, there were many more cases because things like spina bifida, for example, with the improvements in prenatal care and all of that, there are many fewer cases. But does that mean that you're able to deal with more kids who actually do need the help?
Yes. There have been, as you've noted, technological changes which have resulted in reduction in some conditions and maybe not so much reduction in others, but you're very accurate in that in some respects that has allowed us to see more children, and that's the vision of Shriners Hospitals for Children, which is obviously reaching out on an international basis. I mean, that's part of what we're here, but in other areas around the world, the vision is to see more kids in more places that need the specialty pediatric care that we provide. We probably have the largest group of pediatric orthopedic surgeons under one roof, so to speak, even as different locations around the world.
And you've been coming to Cyprus for, I think, close on 40 years.
Yes.
Is it every year or every 2 years? I can't remember, but I know that you do see a lot of children here and you've helped a lot of Cypriot kids.
Yes. This is the 38th year that we have been having clinics here in Cyprus. We have a very long-standing relationship with the Paraskivides Foundation and a growing relationship with healthcare in general in Cyprus. And the Minister of Health last year, we signed a 3-party memo of understanding with the Paraskivides Foundation, the Minister of Health of Cyprus, and Shriners Hospitals for Children. And the 38th year, last year we saw 311 children in a 4-day clinic here.
What happens when you see a child here and you know that some form of orthopaedic intervention is required? Do we have the doctors to do those procedures here in Cyprus, or do they have to go somewhere else? Or do you do them while you're here?
Well, we don't do any intervention while we're here. We have children that are first-time visits. We have children that are here for follow-up visits that may have been seeing our physicians for years. 30 a year, plus or minus, come to our hospital in Springfield, Massachusetts to have some type of intervention.
And who funds that?
The Shriners Hospitals for Children funds the care that occurs at our hospital in Massachusetts. So that care is free to the families. The families pay for the transportation there. The Paraskivides Foundation helps out for families on cases which they may need some financial assistance on the transportation. And as of 2016, Kostas Paraskivides and his lovely spouse Maura established a shrine club here in Cyprus. I became a Shriner here in Cyprus. I'm a member of the Thalassemia Shrine Club, and one of the missions of shrine clubs and shrine centers is to help fund transportation for children. So there's no single answer to your question, but once they get to our hospital in Springfield, Massachusetts, that care is paid for by Shriners. And we have at least one Cypriot child in our facility today there, and she had spinal fusion last week. She's doing quite well. Early in the summer, there was a period where we had 7 families at once in Springfield. And we're very fortunate to have a Ronald McDonald House like a half a mile from our hospital, and it has 21 rooms in it. And these are self-contained bedrooms and bathrooms. And then there are common kitchen facilities and
So the families can live close to the hospital where their child's being treated, basically.
yes, for $15 a night. So it's very inexpensive. So through all of those things, the care gets delivered.
Now, you do, I think, go to many other countries as well. Where else in the world do you do these visits? Is it always 4 or 5 days at a time?
We have a team going to the Dominican Republic in November 15th and 16th. That's a weekend, so we get back, and at least 2 or 3 of the team members who are here in Cyprus are off to the Dominican Republic.
And do you know how the collaboration with Cyprus started?
I do. It was almost an accident. It was an accident. There was a Cypriot woman, Marina, who happened to marry a Shriner, George. I don't know how they were connected. George is from Springfield, Massachusetts. She was here, and actually a refugee from the 1974 situation. And so she ends up in Springfield, Massachusetts, and her sister in Cyprus calls her and says, Marina, we have these 2 girls that need to be seen in the United States for health care. And so Marina says to George Shriner, go up to the Shriners Hospital and talk to Dr. Kruger, the chief of staff, and see if he will see these children. And Dr. Leon Kruger looks at it and says to Shriner, George, yes, have them come over. Well, what Dr. Kruger thought he had just approved were 2 girls not coming from the Republic of Cyprus, but coming from the Cyprus Shrine Center in New York. So it was by happenstance that this relationship began, because the first 2 children that Dr. Kruger saw from Cyprus, the Republic of Cyprus, he actually thought they were coming from New York State in the United States, which is where a shrine center exists that's called the Cyprus Shrine Center. And so it was happenstance, but once that occurred, Dr. Kruger was introduced to Mr. George Paraskivides, and they became fast friends and invited Dr. Kruger to come to Cyprus and hold a clinic. And the Paraskivides, George Paraskivides, then established the Paraskivides Foundation from the business, which has been the main collaborative effort, because the foundation funds the clinical team to come here, pays for our transportation and housing and sustenance while we're here, and I have to say they take very good care of us. We eat mezes 7 days straight and have to go on a big diet when we get home. And we've been able to use the Nicosia General Hospital clinic facilities, and as I mentioned earlier, last year signed a memo of understanding that we hope and are working towards helping a knowledge transfer so that children do not have to leave Cyprus to receive specialty pediatric care.
And that, of course, is going to be hugely important, because if we have doctors in Cyprus trained to carry out the procedures, there isn't the upheaval that there is when they have to travel all the way to the United States. But congratulations on how many years you've been doing this for,
yes.
And I presume...
Thousands and thousands of children as well. So.
And I presume that there's no intent to stop this. It will
Absolutely
carry on.
not. It's a very special relationship that we're working to build different dimensions of. We're not seeing as many children in the clinic this year as we did last because we brought new technology to Cyprus earlier this year. It's called telehealth, telemedicine technology. It's high-definition communication means for audio, video, and also for x-rays.
So you can make some diagnosis from the States.
And we did that significantly. Our Chief of Staff, Dr. Jim Mooney, who's a pediatric orthopedist and spine surgeon, over the past several months saw 125 children over this telehealth technology. Children came to the Paraskivides office, and Dr. Krista Delakis was there with him as a local surgeon that's been involved with the clinic since inception. And then Dr. Mooney is in Springfield, Massachusetts, and he's looking at x-rays of these children with scoliosis. Some of them are new patients. Some of them are patients that he has been following, we have been following for years. Some of these children have had surgery in Springfield, have had spinal fusion to correct their scoliosis.
But the follow-ups can now be done here,
Yes.
and indeed some of the interventions hopefully in the future.
Correct. And so that meant we had to bring one less physician here, and the same outcome without travel involved, one way or the other. So that's a small piece of what we're trying to do. And just earlier today, Nicosia General Hospital has hired a new pediatric orthopedic surgeon. He's been here 5 months. So we have a new connection now to help and work with this physician to establish care here.
Lee Kirk, Administration Officer for Shriners Hospital for Children in Massachusetts.
You can subscribe to the Cyprus News Digest on iTunes for free and get the program downloaded to your phone or tablet so you can listen anytime, anywhere.
You may perhaps know that what is known as Mediterranean anemia or thalassemia has been pretty prevalent in Cyprus for centuries. Now, the numbers are going down, and we'll find out why shortly, but there's good news for those sufferers who are still having to receive treatment, because a new drug for thalassemia, which will apparently halve the number of blood transfusions that they need, is set to be approved by the European Medicines Agency. Joining us to explain the significance of that, and indeed to tell us a bit more about thalassemia in Cyprus, is the Executive Director of the Thalassemia International Federation, Androula Eleftheriou. Androula, will you start by just explaining how important this is in terms of the fact that I know many years ago when I arrived in Cyprus, thalassemia was very much part of life here. But with the screening that was undertaken now for the last couple of decades or more, the numbers have dropped quite dramatically, haven't they?
Well, yes, indeed. Thalassemia is a disorder of the hemoglobin molecule of the red blood cells, and was previously, or in the very early years, thought to be very geographically confined around the Mediterranean countries, that is Cyprus, Italy, Greece. But we now know for some time that this disorder is in fact occurring widely across the world, and it's very prevalent in large populations, including India, China, the Middle East, and of course in Africa, another type of this disease called sickle cell disease. Therefore, this disorder of the blood is related to a number of medical, public health, social, and economic repercussions. And we are indeed very privileged that in Cyprus, from the early years of the 60s and 70s, the healthcare professionals, the patients' parents themselves, had recognized the high prevalence of this disease in the country, and Cyprus, along with Sardinia and Maldives, have the highest carrier rates in the world.
And we should say, for those who aren't aware, that this is a genetically inherited disease, and that's where the screening was so successful.
It is a genetic hereditary disease that is very related to the malaria endemicity. That is why we find thalassemia in areas that are endemic or were previously endemic to malaria, and Cyprus was endemic to malaria until the late 1940s, when malaria was eradicated.
How many people do we have in Cyprus at the moment?
At the moment, there are about 1,000 people suffering, and the government, together with the healthcare professionals, put a very effective prevention program in the late 1970s. And indeed, at that time, the knowledge around prevention and management of the disease was really very confined. People did not know. Science could not help the healthcare professionals to give them knowledge and power of the natural history of the pathophysiology of the disease. So whatever Cyprus, Italy and Greece did in those days were actions taken at the time and were the first, perhaps, attempts to prevent and manage such a disease. And we're so privileged that these elements, in fact, brought a very effective prevention system in Cyprus, reduced the number of births significantly since 1985, where instead of 60 to 80 births that were anticipated to occur every year, based on the carrier rate and the population of the island, the number of affected births decreased to nearly zero for many years. This effectiveness of the prevention system since those early days of 70s and 80s supported the efforts of the government to reallocate resources for improving the clinical care of the patient.
Now, can we just clarify again
Now,
that patients have to undergo blood transfusions, every 2 weeks or thereabouts?
Yes. Thalassemia, because it's a disorder of the hemoglobin molecule of the red blood cells, the blood doesn't produce the right amount of hemoglobin. And why is this important? This is important because hemoglobin carries the oxygen around the body that helps the cells and the organs grow normally. So in order to replace this loss of proper hemoglobin in the blood, these patients undergo blood transfusion with red blood cells once or twice a month. So for Cyprus and for other countries with high prevalence of thalassemia, finding blood donors and having safe and adequate blood for keeping these patients alive constituted and still constitutes the major challenge, the cornerstone of the management.
But they've also got to undergo treatment, because I think I'm right in saying that the blood transfusions and the way their body's metabolism works, presumably, means that they also have to have excess iron removed. So that's another problem, isn't it?
You're very right and very knowledgeable on the subject. Yes, indeed. Because the transfused red blood cells have certain lifetime in our body, and at a certain time they break down. This is the normal biological process of the red blood cells. When these red blood cells break down, hemoglobin breaks down, and the hemoglobin contains the iron inside, which is responsible to carry the oxygen.
So what is it
That
about a
is-
thalassemic's body that can't deal with that like we do?
Well, the biology of a body that does not have thalassemia is that it can excrete a certain amount of iron. But thalassemics have 10 times and more that iron deposited in their vital organs, heart, pancreas, liver, and that amount of blood the organism is not able to excrete. Therefore, despite the fact that blood transfusion gives life to these patients and elongates their survival, they cannot live because the iron that is deposited after the breakdown of the red blood cells, of the transfused red blood cells, causes severe harm to the heart, the liver. Therefore, other drugs have been discovered since the 70s and 80s, one single drug in the 80s, that removed the iron and gave a better health and better quality of life for patients. In the course of time, more drugs were discovered that were effective in removing the iron and therefore improving the life of the patients.
Right, let's come on to this new drug. Reblozyl is going to be what, part of the treatment here in Cyprus?
Well, in the course of time, and Thalassemia International Federation has played a pivotal role in empowering researchers and healthcare professionals to actually support the improvement of the treatment of patients, and this drug completed the trials only last year. Some trials are still ongoing, and this drug is effective on the last stages of maturation of the red blood cells, with the result that more normal red blood cells can be produced versus the non-functional ones that are produced in a thalassemic patient, and this helps to reduce the dependence of the patients on the regular transfusions. That means that their transfusion needs with this drug that is given subcutaneously with injection once a week can reduce by 33 to 50% the needs of transfusion of patients.
So let's get this right. They'll have an injection once a week and presumably for all their life, and that just means that instead of going twice a month, they may be able to go once a month or even once every 5 or 6 weeks.
Or every 6 months, depending on the clinical severity, because each patient with thalassemia has a different clinical profile. So some who are very regularly transfused may reduce their needs by 33%. They may go every 2 months, every 3 months. Others who are more intermediate, who are less severe, may reduce it and may go up to 6 months.
That'll have a huge impact on their quality of life, won't it?
On their quality of life, first and above all, because that's where we are focused as an international federation. But of course, considerable benefit for the public health, because that means you will need less blood for these patients that can be provided to transfusing many other diseases. So there is public health benefit as well.
How much does the drug cost?
Well, what we are being informed is that the drug costs $3,340 per 25 grams of the drug. The drug is given as 1 gram per kilogram. So for an average 50 kilogram, that means around $7,000. And
for each injection?
For each injection. So cost is a problem that we have to address. These are the kind of issues and challenges that we all have in addressing the cost of innovative therapies. And this is where the governments need to collaborate closely and discuss, have an early dialogue with the producing companies of these drugs, so that these drugs don't stay on the shelf but become accessible and available to the patients. And this is what is happening with cancer and other rare diseases. The drugs are there, they are innovative drugs, they can cure a disease, but they're on the shelf because they cost hundreds and millions.
Well, and of course, let's be fair, governments have to juggle the money and balance the books.
Absolutely.
And so
Absolutely.
there might be people listening who say, hang on a minute, how much does a blood transfusion cost? And you're talking about 7,000 every month
but the blood
for
transfusion,
1,000 patients.
Yes, but the blood transfusion is accompanied by iron chelation drugs, which also cost dearly. Therefore,
Yes, but they don't cost 7,000 a month.
They may cost more. Some of them may cost more. There must be a very good calculation, first of all.
Do we have something in Cyprus that's the equivalent of in the UK? They have NICE, the
No, we don't.
clinical excellence and so on.
We don't have, and I was hoping, and I do hope, that with these healthcare reforms, that such a body or a similar committee will actually make this balance. Because I must say that there are some other drugs that bring about the cure of diseases. For example, 6 months ago, a new drug for thalassemia has been approved by EMA. And by the way, this drug has been approved only by FDA, and EMA, we are pending for the authorization of the EMA at the European level. But 6 months ago, there was another drug authorized by the European Medicinal Agent for the cure of thalassemia based on gene therapy. And this cost 1.5 million euros for each child or for each patient.
All right, we have to wrap this up. We've run out of time, but let me just ask you about how many children are still being born on an annual basis here in Cyprus, because the screening and the advice, therefore, to carriers not to get married and have children because the chances of their child having thalassemia was so much higher than if only one of them was a carrier, for example. It has dropped the numbers, but there are still children being born.
Well, I must say that the prevention of Cyprus was based on a very good awareness campaign, community awareness campaign. And the genetic counselling offered to people, and more importantly to at-risk couples, those that were both carriers and carried a 25% chance of having unaffected children, was a non-directive one. That is, the genetic counselling was to explain to the couple that these are the consequences if you marry. You can't go ahead and say to somebody you're not allowed to marry that person. Fair enough, but how many kids are born on an annual basis? In Cyprus, what mattered or what was followed was pregnancy intervention. So there was pregnancy intervention, prenatal diagnosis, and that brought down the numbers. Nowadays, because of more free marriages, marriages outside the church, having a child outside marriage, things are changing. Also, choices of the people are changing. Also, people are seeing thalassemics growing normally and growing and integrating socially and being well because of good quality clinical care.
It sounds to me as if
all of these conditions bring about new births.
Yeah, but it does sound to me as if maybe it's time for another awareness campaign, because it's quite obvious that people have forgotten the message that I remember when it was first introduced to explain. And when you say pregnancy intervention, are you talking about determining whether a fetus has the disease and then termination?
Yes, that was the practice of choice of the at-risk couples in Cyprus. In other countries, the practice was to separate, not to marry. In other countries, was to adopt. There are choices that an at-risk couple can take. In Cyprus, the practice was this.
Fortunately, it isn't anymore. We have to wrap it up there, Andrew.
Therefore, we need to revisit the topic of prevention. We need to bring about the new aspects of science and how to have a healthy child rather than have a termination of pregnancy. But we also need to bring about the importance of prevention in public health in any country.
That is Androula Eleftheriou, who is the Executive Director of the Thalassemia International Federation, discussing there not only the prevalence of the disease in Cyprus, but also the exciting new Reblozyl drug, which will hopefully shortly be approved by the European Medicines Agency. Well, that about wraps up this edition of the Cyprus News Digest. Many thanks for your company. Hope you'll join me next week. Till we meet again, take care and God bless. Bye-bye now.